Hello, viewers, wherever you're watching from. I'm here again, your medical biller, and today's topic is the pros and cons of being a medical biller and medical coder. Medical coders and billers play an important role in the healthcare system, making sure that medical offices run smoothly, patient visits are recorded carefully, and ensure that insurance companies pay the medical office on behalf of the patient. Like any career, there are good and bad parts to being a medical coder or biller. Exploring the advantages and disadvantages of medical coding can provide a balanced view of whether it's the right career path for you. Today, we'll be looking at the pros and cons of being a medical biller and a coder. Most medical billing and coding certification programs can be completed in less than a year, with some degree programs taking about 2 years. These are the basic steps to becoming a certified medical biller and coder. Choose a medical billing and coding training program. There are all different schools that you can enroll for the courses, either in medical billing or medical coding or both. But you are all at a better advantage if you have knowledge of the two. So you need to complete the billing and coding program. You need to pass the certification examination. You need to apply for jobs and start your medical billing and coding career. Now, let's look briefly at what a medical biller and coder does. A medical coder transcribes what happens during a patient visit so that insurance companies and health organizations can understand it. Medical coding takes information such as a physician's diagnosis, patient symptoms, or a doctor's prescription and turns that into numerical or alphanumerical codes. These codes describe each injury, diagnosis, prescription, and medical procedure. This information is used by the insurance provider to fill the claim. A medical biller takes the coded transcript of the patient visit and imputes that information into special software. This information is submitted to the patient's insurance company as a claim. After the insurance company pays their portion, the remaining amount is billed to the patient. Any co-pays and deductibles are figured into this revised amount. Medical billing, like coding, relies on accuracy and attention to detail. The medical billers and coders work together to make sure patient visits are recorded accurately and the record is passed on to the insurance providers so the medical office gets paid correctly and the patient is billed for the remaining portion accurately. So, billers and coders are an essential part of the healthcare system, interacting with the healthcare provider, insurance companies, and patients. They are the liaison with the healthcare provider, insurance companies, and patients. So they play a tripartite role. So let us look at the pros of medical coding and billing. A frequently asked question is, what is an advantage of using medical coding? A clear benefit is the streamlined billing process that ensures accuracy and efficiency in insurance claims. It is a rewarding job. For people who like to work independently and are motivated to get things done without being micromanaged, medical billing and coding is a great career choice. Medical coding and billing is a good way to start your career in healthcare. You can work from home. Medical billing and coding is often a remote job, meaning you can usually work from home. This also allows you to pursue contract and freelance medical billing jobs. By saving time and effort by not commuting, this career can also reduce your stress and help you achieve better work-life balance. Many medical offices were already taking medical billing jobs remotely, but in the aftermath of the pandemic, this became one of the jobs that has become almost entirely remote. Electronic health records, which is commonly referred to as EHR, have made this a job that allows medical billing specialists to work from anywhere. They have a broadband internet connection. You can earn a good salary. A medical coding certificate is worth it. The median range for medical billing specialists in 2023-2024 is $48,780. At entry level, billing and coding specialists may earn less than that, but the highest 10% of all coders earned about $77,810 in 2023. However, with additional medical billing and coding certifications, you may earn even more. A 2023 survey by the American Academy of Professional Coders, that is AAPC, found certified medical coders earn an average salary of $62,160 per year. Another survey showed medical billers and coders who earn 2 professional certifications earn an average salary of $66,198, and those who earn 3 certifications have an average salary of $71,361. Complete your training quickly. Some medical industry jobs require several years of education. Medical coding and billing specialists can often complete a training program and earn certification in less than a year. Online training is available. Many accredited schools have online training programs for medical billing and coding. Since the training does not include clinical hands-on training, the education can be completed entirely through online training. Next, training is relatively inexpensive. Since medical billing and coding programs are usually a year or less, the cost of completing training is less than other 2-year or 4-year medical programs. It is a good work for introverts. If you do your best, work alone, focused on your job, away from other people, medical billing and coding may be an ideal job for you. Since the work is almost always remote, you can work from a home office and avoid being around other people. You can work as an independent contractor. Many billers and coders work as independent contractors, not as employees. Medical coders and billers who work as 1099 independent contractors may work alone or in a team of contractors. You have a steady job outlook. The Bureau of Labor Statistics projects that the number of jobs for medical billers and coders will increase by about 9% between the year 2023 and the year 2033. This increase is due to expanding health services in some markets and churn due to retirements. There can also be demand in certain markets. You can work from anywhere. You are completely mobile. One advantage of this career is that any city with medical offices and hospitals needs medical billers and coders. You could potentially stay in your current location or move to a different city if you choose. Doctors' offices, medical facilities, and other healthcare providers all need medical billing and coding specialists. Flexible schedule. Most medical coders and billers work Monday through Friday, although some billing and coding jobs allow a flexible schedule, as long as you get your work done in a timely manner. You have opportunity to learn new things. The technology in the billing and coding job is constantly evolving. Additionally, that standardized coding is updated every few years. The job is not stagnant nor boring. And if you enjoy learning new things, it can be a job that stimulates your thinking. It can have the start of a medical career. Some billers and coders go on to continue their education and become medical assistants, nurses, or go into healthcare management. Medical coding and billing is a relatively quick way to start a healthcare career that can go in different directions. Medical coding tends to pay more than billing. In entry-level positions, medical billing tends to pay a bit less than medical coding. If you pursue specialized medical coding certifications, you can end up earning more as time progresses. Now, before we go on to the cons of being a medical coder and biller, viewers, don't forget to like, share, subscribe, and hit the notification bell and stay updated on this channel. Now, let's dive into the cons of being a medical biller and coder. Employers want to hire qualified medical coding and medical billing candidates. So, they often query about the disadvantages of medical coding to ensure potential hires are aware of the challenges as well as the benefits. More than anything, they want to have confidence that a medical coder can accurately transcribe a patient visit with speed and precision. With that in mind, here are some of the biggest downsides to medical billing and coding. Number one, you will need technical training. Most employers are looking for candidates who are fully trained and certified. Coding and billing have a direct impact on the bottom line of the medical office and the patient's bill. So getting the information coded correctly leaves no room for error. Your best course of action is to enroll in an accredited training program for medical billing and coding to work in this field. Now, certification and recertification. Because the coding standards are updated every few years, recertification is highly recommended. Information on recertifying for each specific medical coding certificate can be found with the different type of bodies, certifying bodies. Computer skills are a must-have. Almost all the work that you need to do as a medical biller and coder involves using a computer. If you are not tech savvy or you are struggling with using computer programs, this will be a difficult career for you for a long time. And the use of medical software can be challenging if you do not have the zeal to pursue that knowledge. Advancement requires additional certificates. Once you begin your career as a medical coder or biller, you may notice there are different types of billers and coders. For example, there are certified professional coders, registered health information technicians, certified tumor registrars, and more. Some of these positions will require additional specialized certifications. Some medical coders also go into teaching, consulting, or auditing, like I'm doing now on YouTube. I am teaching via the YouTube, giving you an exposure to prospective billers and coders and other health enthusiasts to learn the basics of medical billing and as it relates to coding. It requires a great degree of accuracy. This detail-oriented work affects patient billing and future treatment, as well as patient medical records. Mistakes can never be an option. Medical coding requires deep analysis, its review, and connection to the existing medical records of a patient, ensuring the patient appointment is recorded in intricate detail with complete accuracy. A notable disadvantage of medical coding is the high demand for precision, which can be very, very stressful. Learning new codes and regulations periodically is another challenge. As the medical codes that are used to record patients' visits are updated, coders and billers must also keep up with these changes. Likewise, all the regulations that are tied with those codes. There's high competition for jobs in some areas. In smaller cities or towns, there may be fewer billing and coding jobs, so large cities tend to have a greater number of healthcare jobs, including positions for medical billers and coders. So if you find yourself in a remote area where the facility for healthcare is basic, the need for medical billers and coders will be limited. So you are better off in the town, or you are better off if you can work as an independent contractor. Now, carpal tunnel is a risk, a health risk in terms of ergonomics, because most of the work involves typing and imputing data on a computer. So carpal tunnel syndrome can be a risk. Be sure to take adequate breaks from typing and use ergonomic best practices to reduce the risk of damage to nerves and ligaments in your hands, in your wrists, and your backbone. It can't be a sedentary job. Most of the work is done on a computer, so you may end up sitting in your office chair. One way to nullify the negative effects of a sedentary job is to invest in a standing desk. So all your work won't be just sitting alone. You must also ensure adequate exercise, get up and walk exercise in between. This tends to be a repetitive work. There are times when the work can seem monotonous and repetitive. However, you must still strive for 100% accuracy and you must be entirely focused. It could be stressful during rushing periods. Medical intake can get extremely busy when there are infections spreading. That means when there are pandemics, like in the days of COVID, for example, or in the days of a flu pandemic, for example, you never know what pandemic will be there. At such times, there will be a build-up in demand in traffic to the hospitals, and this will put more stress on you as a medical biller and coder because you are working under pressure and you have a timeline and you must, in spite of the pressure, ensure accuracy of information and coding for the patients. Now, so learning to deal with the stress of performing during peak periods is critical for billers and coders. So, viewers, we have looked at the pros and cons of billing and coding. So, do not forget to like, subscribe, share, and hit the notification bell to this channel. So, let us quickly go over the summary again. Top cons of being a medical biller and coder are: you must have a high school diploma or general education to be eligible for training programs. You must complete an accredited training program. You will need to get certified. You will have to renew your certification. Hey, I'm looking at the cons. You will have to learn a ton of new codes. You'll be responsible for learning any new updates. You must be able to use a computer. You could be at risk for carpal tunnel syndrome. You will spend most of your workday sitting. You will constantly be dealing with third parties. Your entry-level salary is not that lucrative. A career as a medical biller and coder can be very stressful. If you work remotely, it can be very lonely. Okay, let us look at the pros. In summary, the pros of being a medical biller. Let us look at it. The following are the advantages of being a medical biller. Number one, the career path will not require years of college. You can complete your training online. The cost of training is relatively low in comparison to other careers. There's room for advancement always. You can work from home, work remotely, you are mobile, work from anywhere. You do not need to have contact with a lot of people. You can work as an independent contractor. You can work in a variety of settings. You are in high demand. You can work anywhere. You will eventually earn a great living. You can have a flexible schedule. You will also have some nice job perks. Imagine the nice job perks. Extra hours means extra income. Being mobile, being an independent contractor means you can be invited to move from one place to another. So, giving you a work-life balance as you go along, because while you are traveling to go to the next location to work or moving from place to place, you equally be using that as an advantage to sightsee. You can be hired to work on projects for 3 months, 6 months in a different location other than your usual location. For example, you may be required to travel from the UK to Scotland, Scotland to Wales, etc. Some like that, or even moving across countries from one part of Europe, maybe from Spain to Germany, or from Germany to Belgium, or from Belgium to Netherlands. So viewers, we have come to the end of today's topic, which is the pros and cons of being a medical biller and medical coder. Please do not forget to subscribe and hit the notification bell. Like, share, raise your comments, and stay tuned to this channel. See you again in our next topic. Bye for now.